The opinions expressed on this show do not necessarily reflect the views of the Tampa Bay Arts and Education Network.
Hello, everyone, and welcome to another episode of Connecting with Kim here on Tampa Bay Arts and Education Network. I'm your host, Kim Droege, and we have another fabulous show coming up for you today. But before we get started with that, I would like to encourage you to like and follow our Instagram, Facebook, and X account, where you will find all the information about the show, about my guests, about the subject matter, and of course, my on-air wardrobe that comes from the Spring of Tampa Bay Boutique, which is located at 4415 West Osborne here in Tampa. And the net proceeds from both the boutique and the thrift store support their mission for more than 40 years of providing safe spaces and empowering services for survivors of domestic violence and their children. And believe you me, they do a really great job. So I want you to go and shop there, because as you can see from my on-air wardrobe, there is always something, some treasure to find there. Whether it's jewelry, whether it's clothing, whether it's shoes, whether it's household goods, there's always a treasure to find there. I want to remind you too that you can catch the audio of our show on Sun Radio 96.3 FM and on your favorite streaming platform, Monday, Wednesday, and Friday at 3:30 in the afternoon. If you can't watch our show, you can listen to it. So thank you for joining us again. So my guest in the chair, I'm so excited. It's her first time to be here, and I've been preparing for this, and I'm putting in my glasses so I don't make one single mistake. They're actually clean enough that I can actually see out of them. My guest in the chair today is Dr. Julie Serovich, who is the Dean of the USF, go Bulls, College of Behavioral and Community Sciences. And it will also be the future home, and some of you may have heard of this. I was fortunate enough to attend the press conference where this was announced. It will be home to the Darryl Rouson Center for Mental Health and Substance Use Research. So welcome, Dr. Julie, to Connecting with Kim.
Thank you so much for having me.
It's my pleasure.
That.
I've really been looking forward to this.
Those are mouthfuls, weren't they?
I know. You have to go. I was like, I want to, sometimes I don't usually use my notes, but when I want it to be absolutely accurate, I will use my notes, because you deserve that.
I appreciate that.
So we start off the show on Connecting with Kim the same way. We love our guests to share something about their life journey with our listeners and our watchers, because you just never know when somebody out there shares something in common with you. And you can share, go as far back as you want, and share as much as you feel comfortable with.
Absolutely. My family's from the Northeast. I was born and raised in the kind of Pennsylvania, Jersey, Maryland area. I went to Loyola, which then was Loyola College, and it was $5,000 a year. Now it's Loyola University. It's $50,000 a year. And I did both my undergraduate in psychology and my master's degree in counseling psychology there. Worked with kids and youth and substance use for about a year and realized I was not prepared. I needed a PhD. So I went to the University of Georgia and got my PhD in child and family studies, emphasizing marriage and family therapy. So my first academic appointment was at Texas Tech, and I was there for 4 years, and then I went to The Ohio State University. And I went to the ranks there, and after 17 years, decided to move south, move warm. And so I arrived here at the University of South Florida as the dean of a very new college of behavioral and community sciences in 2012, and I've loved it ever since.
So excited for you. What a beautiful journey. I've lived in the Northeast, and I, like you, I graduated from Northwestern University. Okay, yeah. And I remember my tuition at that time, it seemed like, insurmountable at that time, because I was working to pay part of it myself, was like about the same, $5-6 grand a year. And now I look at what students pay to go to Northwestern now, and I'm like, I don't know how I'd ever do it, at this point. And it seemed like a big nut to crack when I was doing it, right?
Yes.
But we did it.
I'm grateful for the experience.
Yes, of course. So let's start there.
Yeah.
What do you do?
So this college was formed in 2008. The provost at the time brought together 6 different disciplines: communication sciences and disorders, aging studies, a natural mix between the two.
Absolutely.
And then social work, which deals with both of those, because kids with hearing disorders will need assistance in aging studies and social work. And then mental health law and policy at the time, dealing with issues around
guardianship and all those. Yeah.
Right, exactly. Criminology, and then child and family studies.
Okay.
And so it's a great combination to be able to look at the intersections of the different areas of sciences and different areas of studies. Like, again, we look at criminology and mental health. We see a lot of overlap in those areas. In the college, we have 3 degrees in social work. We have degrees in behavioral health on the undergraduate level. We have social work on the undergraduate level. And then on the master's degrees, we have obviously social work, mental health counseling, ABA, applied behavioral analysis, and then so in marriage and family therapy, we have all of the different disciplines in one particular college in the mental health disciplines, which is very unique in the state of Florida.
I would say so.
And we don't have it anywhere else.
You're located at the main campus, right?
I am, over in the medical area of the main campus.
Okay.
Yes.
So how many folks comprise this college?
So we have it fluctuates between 2,000 and 3,000 undergrads. We've always had about 750 to 800 graduate students, primarily master students. About 115 of those, though, are PhD students. We have 200 faculty. Half of them, though, are tenure track, and the other are what we call soft money. And that means that they are supported by grants and contracts that they bring in. So they bring in the grants and contracts, and they work on them, it's kind of self-sufficiency there. So we're very grant active. $34 million in grants and contracts last year alone, and so a big part of what we do will lead into the other conversations is research. And so we have, again, about 300, 400, 500, 600 staff that support all of that.
These folks that come in, the soft
money folks,
soft money folks that come in, are they also accredited professors and leaders in their field?
Absolutely, they are.
Okay,
that's why they get the grants and contracts, because they are leaders in their field.
But they're just not. I'm not asking this question correctly.
They're not
Forgive me.
tenure track.
Yeah, they're not going to become a permanent part of USF staff.
Correct.
And they might after 2 or 3 years with you, they might go someplace else.
And typically they don't. Typically they stick around for 10, 15, 20 years.
Really?
Oh, absolutely.
That's amazing.
And the state keeps after a while you generate such knowledge base that the state doesn't want to give that up, and they want to continue to support the information and the research that you're doing. And so no, they stick around for an awfully long period of time.
But why would they not be? So I guess what I'm really trying to get at is why would they not be tenure tracked? That's the part I'm trying to understand.
Some of the times they just don't want to.
Okay.
And they might not have the credentials.
Right.
You can be a faculty member with a master's degree, and the research faculty, a lot of them have master's degrees. So sometimes they don't want to. They love the work that they do. They love the work that they do with the state, and so the tenure is a pressure. Because
I mean, you gotta. I'm assuming it was the same. It's the same now as when I was at Northwestern. You've got to publish. You've got to do all kinds of things to reach tenure.
Correct.
You have to be sometimes a book, or maybe multiple books, or you have to be invited to teach at other institutes, and so on and so forth. Right.
So to be in tenure track, you have to distinguish yourself in terms of research, service, and teaching.
Okay.
If you're a research faculty, you do research. Mm-hmm. And so if you love that, it's perfect for you.
Yeah, perfect for you.
Yes.
So let me ask, do these grants also come with, do you have to have studies associated with them where you have to bring folks in to participate in studies? Yeah, I want to understand that better.
Yeah, so it depends on what the state wants. Sometimes they want policy work.
Okay.
And sometimes they want to understand what's happening in terms of policy. For example, we're doing a study right now on peer specialists. So what a peer specialist is somebody that is either has had an addiction, has had a mental health challenge, they've overcome it, and they want to professionalize. And so peer specialists across the nation were looking at to see, you know, what kind of training would they need, what kind of value would they bring, what are the obstacles for them. And so that's a policy kind of research project. So that wouldn't necessarily mean bringing people in, it would mean studying policy and looking across the states about who utilizes peer specialists to assist in, say, human trafficking, you know, or again in substance use or in mental health recovery. And so it doesn't necessarily mean that they're doing that kind of work. We also have those that do like trainings. So we have grants that do training to help teachers, say in the classroom, be able to better manage their students in terms of, say, their acting out behaviors. So we're charged with going in and training high schoolers or elementary school. Usually it's elementary school, middle school, on how to deal with these disruptive children in a very positive manner. So it doesn't necessarily mean doing the pencil paper, the traditional kinds of research that we think about when you're primarily in the tenure track.
And I would imagine this means that you folks work a lot with the policymakers and the legislators in Tallahassee.
That's right.
And beyond.
Correct.
Right?
Correct. We do a lot of work with of DCF, Family and Children's. You know, we do a lot of work with Department of Education. So yes, it's not just National Institutes of Health. You know, or
so it goes beyond Florida.
Yeah, absolutely.
Right, to the feds.
Absolutely.
So to speak.
Correct. That is correct.
And you must be leaders in your field. You must.
There's no question.
Yeah.
There's no question. We have probably the leading applied behavioral analysis researcher in the country in our college, and he has built an incredible program, and he's just one of many. You know, they're all really superstars in their own way, and they want to be here because USF is clearly a rising star, and we are becoming the star in the state of Florida. So it's an attractive place to be for them, and of course the Tampa Bay region as well.
Well, exactly, but I think that this is something that they get short shrift. I think historically, I'm glad to see it's changing, but I think Florida universities and colleges historically have gotten short shrift because people look at it as, oh, you're just going there, because it's, Florida and it's a great place to be and sunshine and blah, 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 and beaches and whatnot. But no, I mean, we really are academic stars.
Absolutely. There's absolute no question. And that has been, especially in the last probably 15, 20 years, has been a real emphasis on quality, on student success, on student employment afterwards, on getting people graduating on time, 4 and 6 year graduation rates. 6 year for those who may have to go through like the state system, take a little bit longer, they have to work, they may be unconditional, untypical students.
Right.
And so, yeah, all those focus now are heavy on the state university system, and we have to make sure that we produce and make sure that students are, again, successul. It's changed everything.
It's a welcome change, right?
Absolutely.
I mean, wouldn't you say it's a welcome change?
Absolutely.
So if you're just starting out and connecting with Kim, my guest in the chair, and I do not want to screw this up because she deserves every laudit she has, Dr. Julie Serovich, who's the Dean of the USF College of Behavioral and Community Sciences. And it will also be the future home, and we're going to shift and talk about this. It's going to be the future home of the Darryl Rouson Center for Mental Health and Substance Use Research. Let's kind of transition now, and because this is a concept right now. It's not a real. You're not going to go to the campus and see, touch, and feel it, right? So let's talk about how you're going to transition, how this is going to develop.
Well, I know that you know Senator Rouson.
I do.
And I'm eager to hear a little bit about that as well. But Senator Rouson has been so helpful and so hands-on in assisting me in building some very important centers in my college. He was very involved in the trafficking in persons for human trafficking research, getting us funding to be able to look across the state of Florida and say where is the trafficking occurring, helping law enforcement know where to look in terms of intercepting human trafficking. And then just last year, he was very helpful with Senator Pasadomo and, of course, Governor DeSantis us in giving our college the Behavioral Health Workforce Center. And we are charged with attracting, retaining, and training at a very high level mental health professionals in the state of Florida, because we are one of the lowest in terms of per capita in the United States. He was just a champion for us. And so this year, last year, as he's moving, and this is his last year in the Senate.
The Senate anyway.
So
we're not really sure what's going to happen after that.
Right. So, as he's moving in, it was only right for the University of South Florida to thank him for, the work that he's done and the tremendous work that not just in my college, but throughout, and
it's true.
Better than I do, but just tremendous amounts of work. And so they've honored him this past September.
He really deserved it, and I was thrilled that he invited me to be there at the press conference. He had a certain amount of people he could invite, and I was really thrilled that he invited me to be his guest. What I admire about him as a person is his openness about his journey and his struggle, which continues daily because he still attends meetings and he still, it's something that you have to fight every day. And what I also admire about him is when, so session ended finally, and they had time off. And what did he do with his time off? I can tell you exactly what he did. He went and visited centers all across the state of Florida that he has provided help and funding for, to see exactly how they are using that funding.
Absolutely.
And you got to admire that, because a lot of people, they get done with session, they go back to their real lives, because he's a lawyer too, like a lot of them, but they don't do that.
We know we're going to be held at a very high standard by him, and I welcome that. When he's come back to the TIP lab, we update him consistently. Although the new Behavioral Health Workforce Center just started last July, we're constantly updating him, because I respect that a great deal. And so this center, I've told him, we will make him proud. We will make him proud with this new research center.
So how do you envision this research center? I mean, what? Give me a little. I know it's still conceptual, but but I'm sure you've thought about this. Kind of give me some bones about it.
Yeah. So actually, right now, I sent an email out to the college, and I said, this is a great honor. And we are going to honor this man and the work that he's done. And anybody, I'd like to form a small group to help me start looking at strategic planning, about a process, looking at a structure, looking at a mission, a vision, all of those things that are basic before you start an organization or start an entity, right? I had over 30 faculty raise their hand.
Oh my gosh. Now that's a testament, right?
Faculty.
Right? Yeah, you're probably surprised, right?
Well, I was shocked.
Yeah.
Because I figured, we have incredible researchers in the areas of mental health and substance use anyway. I mean, we already have. That's why he gave it to us.
Yeah.
That's why we are building it.
Right.
Basically, because everybody knows that when you want to do that kind of research, this is where you come. And so this is why it's in the college. And so I guess maybe I shouldn't have been surprised that so many people raised their hand. But in I think 2 weeks, we're going to have our very first conceptual meeting, and we're going to begin by again starting a strategic plan and saying from the very beginning. Now, I've talked with Senator Rouson, and I know he wants very high level research. That's what I want. This should be the highest level. I expect that people will be writing federal grants to do the work, not just here, but internationally. And I want to challenge them to really think even more globally about the work that we could possibly do, because substance use, mental health does not stop at our borders.
No, of course not. It's a worldwide problem.
It really is.
And COVID just exacerbated and, in my opinion, accelerated
There's no question.
the whole explosion in this area, right?
There's no question. And so we shouldn't be thinking just within our borders in
Right.
ways of taking what we do and help other countries potentially take the interventions that we develop and test. We shouldn't be thinking small about this. I don't want to think small.
No.
And so we're very excited. We're very excited about it.
Is it going to be housed in the existing facility, or are you going to have to build a new facility?
So in my building,
Or build on?
Yeah, literally in my building, we are renovating space to accommodate both the Center for the Florida Center for Behavioral Health alongside of the Rouson Center. The overlap is really, it's just natural that they would be together.
Right.
So I have a wing of the building that we have cleared out and we're starting renovating, and we're going to start building hopefully here pretty soon, so that we can. Right now, the Florida Center is dispersed all over my building.
Right.
They're kind of everywhere, but we are going to find a kind of a home for them, and we're going to put them together, and again, in his honor, in one specific space. That's going to take a little while.
Do you have a timeline for, do you have an end goal, a timeline for when you'd like to have this all put together?
It's exactly what the faculty want to know too.
Well, of course, because
they're like, what are we doing? When are we going to get started?
When's this going to happen?
Yeah, and I'm trying to be patient. I want to do this right, not fast. And so I think if it takes us a little bit longer to make sure that we get the vision right, we get the mission statement right, we get the strategic plan right, we get the org structure right, we get the funding piece right, then if it takes a little longer, I'm not putting any parameters on that, but I would like to have, by the time he's done in the Senate, I would like to be able to present him with a very comprehensive plan for how we would move forward, and that would be next July.
If that would be next July, then you would maybe, do you envision this being like a 2-year, 3-year kind of horizon before this thing really comes together?
Once we have the plan, we're running.
Oh, really?
Absolutely.
Well,
There's
no
question.
Because I gotta say, I think we're October, and to have that to present to him in July, my goodness, you're going to be moving. Yeah.
Depends on your perspective, right?
You can have your first meeting yet.
Right. So Florida Behavioral Health Workforce, we started in July. In October, she produced the first report to the state in January 7th or January 8th. We just released a dashboard that shows where all of the clinicians in 6 different disciplines are across the state of Florida, where they're not. And not only can we say where they are, but what's the anticipated demand. So we have supply and demand. It's on the website, and it's very easy to navigate by your county, wherever you want to see. So we did that in 14, 15 months.
Yeah, I'm impressed.
So and
I want you to get on this, but trust me, I'm looking forward to this.
To me, having a conceptual plan by July seems a little on the slow side in comparison to what we did with the first center. But the first center, the behavioral workforce, it was already designed, and it was decided by the state what they wanted.
Right.
And the state laid out very clearly, this is what we want, and this is the timeline that you have. And so this is a little more free flowing. It's the university that basically has instituted
control over this, yeah.
Correct. So I feel like I have a little more time. So to me, it doesn't seem quick compared to the Florida Center, but
I'm thinking ceremony, presentation. I'm thinking, we think big time here.
Yes, absolutely.
We're in media, so we always think big time.
There's no question.
So we're just about out of time. So I want to ask you, what else you'd like to share with us about the important work that you do
I
in
think
your
what's
college?
very important and very different about this center is if you look across the country, you will find lots of centers that focus on mental health and then might have a division of substance use. You'll find a lot that are focused on substance use that will then look at maybe one aspect of it to be mental health. Others could be other areas that they also focus on. This will be one of maybe 2 in the nation that focus on that intersection between mental health and substance use. And I think that is, you would think that people have been already doing this already, and they have not been.
No, because I think the academic world, and I don't know if you'll agree with me or not, but it seems to me that the academic world historically has been very siloed.
Right.
You have your disciplines. Everyone focuses in that discipline, and there's what you're proposing and what you're doing is an integrated, holistic approach, because that's exactly how humans are. They are integrated and holistic. They are not silos. Our brains are not compartmentalized that way, right?
And that is why this center, I think, is going to flourish in this college, because the criminologists are working with the mental health specialists. The aging population cannot be denied in this.
No, absolutely not.
We are seeing across the nation, opioid deaths are on the downslide, which is great, except for the 65 and older.
That is shocking to me.
Except for exactly.
It's saddening and shocking at the same time.
So we can't. So the mix. That's why it's good that we began this conversation about the mix of the college, because the mix of the college is exactly what the mix in terms of how we're going to study that intersection. The contributions from every single one of those disciplines is going to be very important.
Well, it's reflecting real life, what's happening in real life. And what would you, I mean, just out of curiosity, I'm not trying to put you on the spot. We don't do that on my show, but just out of curiosity, why do you think it is that statistic is not decreasing in the over 65 population?
We have just been commissioned by Live Tampa Bay to look exactly at that question. And so I'm hoping in the next several months we'll have some pretty good answers to that. But I think what's happening is, number one, that those people that are 65 and older are also using other medications.
Yep. They're overdosed.
And so if you're not properly managing your opioid usage because of, say, a hospitalization for a surgery or whatever, then you have these things unfortunately occur. We also don't look at the 65 and older, but the 65 and older were young in the 70s, right? Mm-hmm. They were the hippies of the 70s.
They were the hippies and the drug users of the 70s, right? Yeah, let's face it, it's true.
We can't ignore that.
No, can't ignore that.
We've been commissioned, a faculty in my college, to look exactly at that question, and we're very eager to find out what is happening. But I think those are two things that we're going to hear. Maybe others, which I'm eager to find out, because we need to correct it.
This just means that you're going to have to come back, because
we
we want a follow up and an understanding of this, right? Because we're all approaching that 65 and older category, so we want to make sure.
Right.
Yeah. Well, Dr. Serovich, I really am so thrilled that you were with us today on Connecting with Kim. I mean, what an interesting topic. I love the way you all have been and will continue to approach these very significant issues, because again, it's holistic and integrated, which is exactly how a human being exists. So if you're just joining me now on Connecting with Kim and you have to go back and watch the whole episode, my friend in the chair is Dr. Julie Serovich, who's the Dean of the USF College of Behavioral and Community Sciences, and also the future home of the Darryl Rouson Center for Mental Health and Substance Use Research. And we're all very excited about that. So she's going to come back and give us an update on that. So thank you again.
Thank you. Appreciate it.
It was my pleasure, believe me. That's all we have time for today on Connecting with Kim. We're going to ask you to come back next week. Like and follow our Instagram, Facebook, and X account, where you can find all the information about our show and our guests and the topics, and also where you can find more information once we've whet your appetite. But we want to thank you for joining us today. Thank you to the Spring of Tampa Bay for providing my on-air wardrobe from their boutique. And come back next week here on Connecting with Kim, here on Tampa Bay Arts and Education Network. Bye.